following Mind and Body segment is brought to you by Advanced Cosmetic Surgery.
Well, Dr. Thomas McFadden is with Advanced Cosmetic Surgery in Greenville, South Carolina, and he has helped us with lots of questions that we have had in the past. We've got him back, and joining him is Melanie Baker, and Melanie has a wonderful story. Today we're going to talk about something, massive weight loss, and I ask you ahead of time, massive, is that the correct term? That is what is used.
Yeah, massive generally bypass.
Well, and Melanie has lost 180 pounds.
Correct.
Unbelievable.
It
Now, Melanie,
really is unbelievable.
You have, tell us a little bit about your story here.
Just an obese person my entire life, and went to Dr. McFadden to get it removed. He suggested gastric bypass. I had the gastric bypass. The gastric bypass worked.
Right.
A few months later, back to see Dr. McFadden, and there starts the story of the skin.
The
You don't think.
Tighten up, right?
Let's go
Correct.
ahead and take a look at
Okay.
some of these pictures, and you're going to see some before pictures of Melanie there. Unbelievable, first of all.
Yeah, this
Just
is
unbelievable.
This is Melanie, how she presented to me in the office, and she said, "I'd like to have a tummy tuck and liposuction." I said, "Well, not really a good idea. You'd probably be better off with the gastric bypass." So she went off and did that. And in the next slide,
And that's not something that you did, right?
No,
the gastric.
no, you referred to Dr.
Let's make that clear
yeah,
with people.
Dr. Bohr, Eric Bohr, did a nice job and lost a bunch of weight. But prior to that, she had gotten as bad as 290 pounds, and you saw a picture of her there at 280. And here she is before and after the belt lipectomy. The picture on the left shows her after the gastric bypass, but she has all this extra skin,
Right.
which we took off with a belt lipectomy, which is an extended tummy tuck all the way around.
Okay, now there are lots of options out there, and we're going to go over some of those, but when is surgery necessary in weight loss?
You really need to do it. In other words, they need to be level for about 3 or 4 months and not losing or gaining weight at any time. That's the appropriate time. They need to be in relatively good health. You see in these photos here the excess skin she has, tremendous amount. We actually took off about a foot of skin just above her belly button down to her pubis, and you see the after photo.
Right.
But
So the skin doesn't tighten up by itself, I mean, even with exercise,
Not
right?
even with exercise.
not after the massive weight loss, because it's cut off.
When I was liposuction used at all to get rid of some fat, or?
Liposuction is used in conjunction with these other surgical procedures, but it is not a good option by itself because of the excess
It would be
laxity of
a
skin.
Band-Aid by itself, right? I mean, it wouldn't.
It would take out the bulk, but it really wouldn't help the laxity. In fact, it would worsen
Right.
it. But again, you see the extra skin here. She's pinching it, and all of it was taken off all the way around.
Melanie, you've been through quite a
Now
lot.
look at those pictures.
Amazing results. Because to do it right, it takes a little time.
Did you do this over a weekend or something?
It was a tough weekend.
Tough
The after gastric bypass, I was at goal basically in 9 months, and then what Dr. McFadden does doesn't take very long at all.
Right.
So there's a
the main
recuperation
time is
losing the weight, and then making that step, taking that step to get rid of the excess skin is
Okay.
what.
Well, as Melanie says, she's a work in progress. She's had the belt lipectomy, but she wants to tighten up her arms also, lift her breasts as well, and then she can do a thigh lift later.
Okay.
So those are some other
So that part of the lady's underarm that swings in the breeze, you can fix that?
the waddle, yeah.
My wife complains about it. Is that what that's called, the waddle?
What, you can call it whatever you want.
The arm
Whatever bad term
waddle.
I want you to give us maybe some general points to remember when it comes to plastic or cosmetic surgery.
Plastic surgery, remember, you should trust your surgical and non-surgical cosmetic needs to a plastic surgeon. Even for Botox, lasers, fillers, you should seek someone who is board certified by the American Board of Plastic Surgery. And ask to see a lot of photos, before and after photos, ask a lot of probing questions. Not really how many have you done of some.
to have something done
Yeah.
before she came back to you. That's impressive.
True
I
sign
think.
of a
Some
doctor
doctors
that
may not have
cares.
done that.
It's the right thing to do.
Yeah.
She's a wonderful lady, just a beautiful person inside and out.
You got 43 children or something like that, right? How many do you have?
I have 4 children.
4 children.
Three
All right.
boys and a girl.
Melanie actually does
And
have
a
a great
grandmother.
story. And if you'll keep watching your Carolina, you'll see an expanded story of Melanie as well. Dr. McFadden, we appreciate it if you guys
Thank you.
have.
We want to talk about the sandwich generation. You know, it's tough enough raising kids, but what if you have kids at home and you're trying to raise your parents with your kids? Wow, 3 generations. We'll talk to Dr. Roger Rhodes about that coming up.
Okay.
Thank you.